welcome, everyone, to this live session, Empowering New Nurses. I'm your host, Dr. Miriam Amanda Smith. I just want to say thanks for coming on. I appreciate your presence. So tonight, let me hope you had a good day. First of all, mine was interesting. Let me hope yours was good. I've met different individuals today. I've talked, I've discussed stuff, and just interestingly, we're still alive. So we got so much to be thankful for. So let me hasten to say to my young nurse, my seasoned nurse, and all the nurses globally that the community expect us as nurses to be compassionate and to be empathetic. Most times, we are the first point of contact for our patients when they are in pain, when they are scared, or when they're anxious. And empathy definitely helps them feel heard, cared for, and understood. Interestingly, I've been on the plane already, and there was an emergency. They were asking if there are any nurses on board and, doctors and the medical personnel on board. You might be on the unit. You might be in a crowd on the street, and you'll hear somebody asking if there's an emergency. Is there a nurse around? Or who knows CPR? Or so, like that. I've heard those sort of statements before. Now, remember, we have gone to school. We have gotten different training. And of course, communication skills are so critical. We have to remember, we have to be what? We have to be clear. That's one of the pieces of effective communication. We got to be clear. Number one, the patients want to be understood. Patient want to understand what you're communicating to them. The family members want to. And of course, as we communicate with the interprofessional team, it has to be clear so that the right care can be given to our patients. Right communication, the important messages to be conveyed so that you can have the accurate care plan for that patient. The community, the nursing community, and the general public, they expect the nurse to pay attention to details. Of course, because we are the ones, the nurses are the ones who handle the medication, who handle certain care for that patient. And that details documentation. Following procedures correctly and protocols, very, very important in nursing. Because of safety, we ensure that the patient is safe. That's one of our goals. The general public expect the nurse to be meticulous, to follow protocols accurately, and to double check their work. And as you know, that nursing is such a profession. It's so beautiful. It's demanding. And at the same time, it's so satisfying. When a nurse renders that quality care, that high quality care, you can be sure that that patient in a general setting will also be happy because of the type of care, which include a trusting relationship with that patient. That patient develops that type of relationship with the nurse that not necessarily happens with the doctor, because the nurse is usually the one around the patient more frequently. And so there are certain expectations, critical thinking. The nurse has to be on top of things. Why? There are certain decisions that has to be made sometimes quickly in an emergency because of informed information that's given that allows the nurse to make those decisions quickly. So here and there, a nurse, the public, and the patients, and those who are there, and family members, they expect the nurses to be advocate for their patients. The patient and most times they are so vulnerable, they're not able to make certain decisions sometimes. And so they're expecting the nurse to talk up for them, to say something for them, for the good of them, so that they can be safe and they can get adequate and the proper and the appropriate care that they really need. So I would say the nurse, the public expect of us, and we should in turn do the best for our patients and advocate for them. And let me say at the same time, although we advocate for our patients, we have to advocate for ourselves. You know, being a nurse for a long, long time, and as I said before, I retired recently, but I have the passion to share my knowledge that I've gleaned for more than 4 decades to my younger nurses. Behind that, a little background, I came to this country 1986 as a critical care nurse from Jamaica, West Indies. And I had gone to University of the West Indies to do a postgrad course, and that was in critical care. I'm passionate about that. I really love caring for people. I don't have another profession. And so my years of service to humanity in many, many roles have been satisfying to me. Of course, I've had challenges like anybody else, but caring for others and getting that inner satisfaction from helping somebody's pain, for listening keenly to situations and be able to problem solve. So being able to relate to individuals at their most vulnerable point has helped me. And as I share some of my experiences with other new nurses while being onboarding or on orientation, so when some of them sometimes are challenged, has helped me. And I know for sure that I've passed on the baton to many. And I've seen where different ones would say, send me an email or so, your girl has done this, or your girl was awarded for this. And that makes me happy. And I also can remember times when I was teaching, those skills. And nurses would come to me and say, I've never done this. I've never done an IV. I've never inserted one. I've never inserted a Foley catheter, or I've never, whatever some of those procedures or skills that we would normally teach, which one builds on. It's not done overnight. So if my new nurse is right there now thinking about it, can ask any of us senior ones or who have passed before. It did not come overnight. Some individuals are fast learners, they learn quickly more than others. However, I've seen cases from my personal experience and experience of others. Some of those who have taken a little longer time to learn certain procedures, they have been some of my best nurses in the sense that my 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 preceptors or my staff would say or would show salute those nurses. Some of them have gained that confidence after a while, that and the care, that compassionate care that the patient is looking for, not the computer now, but that compassionate care that that patient is looking for, or the needs that are being met by that patient. They would leave upon leaving or say it before that they salute and they want the name to be written there of the quality, the high quality care that the patient receives. So It's so, so, so important to render that type of care. In addition to that, think about teamwork. No man is an island, no man stands alone. And therefore, as you care for your patients, also care about your colleagues. Be mindful that your day will come. Many times, our patient becomes, I would say, in quote, dicey or starts deteriorating rapidly. That wasn't the plan of the day. And that's why, as nurses, we have to be prepared. So you have to jump over and help participate in the care. All the patients on the floor belong to each of us. In that I mean, or by that I mean, you might have gotten that assignment, and that's number 1, 2, and 3, the assignment for that you're caring for on a one-on-one. However, the entire unit, we all care for those patients. So we have to be mindful of that every time. The patient family comes on the unit to see that patient, but not because it's not your patient, you can't say where that family member should go or see the patient. There are some basic things. The patient's condition start deteriorating. As a young nurse, you don't run and hide or say it's not my patient. Be a part of it, because the time is coming when your case, that will happen to you. And the more you gain some experiences, when the time comes for you, you'll be able to function better. So it's not a matter of, it's not my patient, or it's not a matter of, I can't hand the bedpan as a registered nurse or a LPN or whoever. That, until, yes, I know there are different roles, yes, and there are certain responsibilities. However, I must let you know that you, as a registered nurse or whoever you are, and you can hand that bedpan, you can tell the PCA, you can tell the attendant that you have done that, and then they can finish up. However, don't think that because you're a registered nurse, you can't do that. No. Always remember, it could be your mom, it could be your sister, it could be you there, and you want that image care. I remember clearly when I was hospitalized to have my firstborn, and I had a PCA pump on, but the medication was not effective. And I was calling to the nurse. And I was a nurse. And I heard the nurses talking on the outside and talking. And I felt so badly because I didn't treat people like that. So when eventually the nurse came, I really felt uncomfortable. So I just want to encourage my nurses. Um, I just want to encourage my nurses, male, female, wherever you unit you serve and whichever area of specialty you are, that the patient needs an advocate, needs you to be advocating for them, and as you advocate for yourself, someone needs you, and the person, as you collaborate, teamwork is important. Always remember, teamwork is important, especially now when there's so many limitations, there's so many shortages, and unless we pool our resources together to make it happen, it can really, really be challenging. And so we have nurses leaving the profession. I went to a podcast in Dallas, Texas, not long ago, and I interviewed different individuals. And then I remember more than one person mentioned that the family member left nursing because they were not treated well. No, I don't want that to be from my nurses. I don't want to hear that about my nurses. It can be challenging, but remember, there are some good days, right? There's some good days. There's some good days. So whatever method you're going to use, resources, tap in some resources, get a mentor. And bear in mind that that mentor does not have to work at your immediate hospital, but you can have someone from another area who have experience who can share their views with you. And I want to say thanks for coming on, everyone. I appreciate you coming in. And if you have something you want to share or us to discuss at some later date, you can put it in the chat. You can put it on Miriam Amanda Smith on YouTube. This is my book. If you haven't got your copy yet, Nurse, the guide to empower new nurses in the delivery of high quality care to all patients. And I emphasize high quality and I emphasize all patients because I do believe in culturally congruent care. Now, I've taught transcultural nursing for some years, and I've also taught community nursing, although I've been a critical care nurse. So you can see on the outside, in the community, and also within the critical setting. But it's always been rewarding and to see that you've done your best for your patient and to see them recover. Yes, we know that not all of them will recover, but you continue doing your best for your patient. So I'm going to say thank you so much for listening. Now, how can you obtain this book? This book is an Amazon bestseller. You see the sign there. And I've spent more than a year, not more than a year, putting it together. However, information was being gathered before mentally. But as I retired and I recall some of my experiences on onboarding new nurses and on orientation, I've decided, of course, with others' input, you can do this. And if you have some experiences that you want to share, remember you can also have your book because, you know, there are billions of people out there who want to hear your story, my story. More than 8 billion people are out there who wants to hear. They want to hear your story, and your story can inspire them. Yes, it can inspire them. There are individuals who are right just at that little edge where they want to say, should I do nursing or should I not do nursing? Or should I continue in nursing or should I stop? Well, not bother with or going to another profession. But we need nurses. We need nurses. As you know, if you don't know or you recall at this point, but we have baby boomers like myself. These individuals were born when 1946 through 1946 through 1964. And you have the aging now, more than 65 now, right? So you have individuals leaving due to age, also to the COVID or to other personal reasons they have left and they're leaving. So we need replacement. Of course, we need this noble profession to continue in the right direction. So think about it if you're not nurses yet, or think about it if you are nurses, but you want to transition into another year. Another evening, I will come alive and you can be feel free to leave a healthy, helpful comment. Now, on my website is Miriam is Empowering New Nurses. On Instagram, it is all right. So your wife, Jamie, you got to get this book. Your wife, you got to get it because I have tidbits in there that can help her on her nursing journey. Is a young nurse, and you can share this with others. I've been on panels. I've been residency program. I've participated in residency program. I've also spoken to a group just about 2 months ago. Yeah, yeah. So it's on Nurse, the Guide to Empower New Nurses in the Delivery of High Quality Care. I also have given some of my experiences caring for high profile patients, caring for different type of patients, being at 9/11 down there, being one of those responders, first responders, traveling different parts of the world. Also, my experiences as a nurse educator for many years. So It's a bunch of stuff, but you will see some of the fears that new nurses experience. They're in here, and some of the suggestions given. And you can see for yourself. You can go on Amazon. You can look at the rating. You can look at the testimonials. It's also an ebook. It's an ebook and paperback book. So feel free to come on. Feel free to comment. I appreciate you. Have a great evening. Thank you. Thank you. All right.